I have to tell you, this is my 20th year attending the American Academy of Dermatology. So it's my 20th year anniversary, and I never miss this meeting. For me, it is the largest convention of everything that is related to dermatology, whether we're dealing with medical, whether we're dealing with surgical, or even cosmetic. This is where all the different minds come to meet. And every American Academy meeting is a little bit different. This one over here is held in Orlando, and it has this lively atmosphere and so forth. So for me, the significance is the science being one, and also the networking, because you get to see different people from different parts of the world also being a part of this Congress. So I am a cosmetic dermatologist. So most of the work that I do is in cosmesis, and especially in the area of soft tissue augmentation. So mainly fillers, botulinum toxin, and also energy-based devices. So the things that I'm basically looking forward to. I mean, there's been a huge boom in this industry, and I usually like to come to the AAD because this is where all the great minds come and talk about all the new things that have been coming up in a very non-biased, scientific way. So for me, I mean, this is where I will be getting a lot of my tips and tricks to use on my patients. Well, combination treatments is the key, because the way that our body is, it doesn't exist in just one single plane. I mean, there are many multiple planes in which that are affected. So you can't just use one thing to treat everything. It has to be combined. All the different modalities have to be combined to get the best results. So you need to combine your energy-based devices, which are your radio frequency machines, your ultrasound, and so forth. You need to combine them with your injectables, such as your fillers, your biostimulators, the polylactic acid, the polycaprolactone, your HA, and also your botulinum toxin, in addition to chemical peels. So all of these have to be combined together. And not only this, I mean, the combination has to work also at the hands of the patient. So after the treatment is performed in the practice, the patient then goes back home and requires a skincare routine that actually also tends to work. So everything. So we're dealing with this type of combination allows pretty much the treatment to have the best results for our patients, and at the same time for them to be quite happy with the results. So, I mean, the field of dermatology has always been, booming, especially in the cosmetic aspect of things. I mean, especially when we're dealing with the energy-based devices. And that area in itself pretty much has seen a huge drastic change. And one of the reasons why we're coming to the Congress here is pretty much to learn about these new things that are out there that people have been using, and at the same time try to kind of, you know, bring in experts from different parts of the world who usually will talk about it. So it's basically bringing in the manufacturers from whatever they may be, whether it's Europe, whether it's in Asia, or whether even here in the Americas, and then for them to kind of showcase and discuss these type of treatment modalities for the practitioners, so that we can then move on and practice on our patients. I tell you, AI is crucial in a number of things, and we've been looking at all these different studies that have been published that are out there, in which AI is able to kind of tell whether, for example, a lesion has to be biopsied because it may look malignant. It is also equally as good in taking, and knowing, for example, if a lesion is, for example, a melanoma. AI is able to kind of utilize this, because dermatology is a very visual field, and AI in itself is able to kind of see this, formulate an algorithm, and kind of showcase exactly where the treatment is going to be, whether a medical treatment is required, whether a biopsy is required, or whether even surgical treatment is going to be required. So AI for me has become crucial. And for me, it's the sky's the limit. I don't think it's going to take over the dermatologist's job. I think it's going to supplement it and make our jobs much, much easier. So I am attending the Chinese session because, for me, I mean, I always want to learn something that's new, and everybody basically has this mystery when it comes to China. And and I have to admit, I mean, a lot of the science is in that area, and a lot of times, I mean, they're also very highly prolific. So for me, I mean, to come and to attend such a session, I get to learn a lot, especially with things that I may not be able to do in my own practice, or I may not even have seen because of the sheer number of patients that they're able to see in China, and at the same time, the level of dermatology practice in there. I visited China a few times. I've visited their departments. If you're able to see nearly 3,000 individuals in one day, okay, that means you have the whole textbook that you're able to see in one day. So for me to come in for just 2 hours to attend their session is something that's very, very important.